Good morning. Buenos dias. Welcome. It's an honor for me to be here today in the company of so many county and community partners, united on securing community safety so that children and families know that they can live, work, play, learn, pray, and grow without the fear of violence. Thank you all for being here. I do want to start by asking us for a moment of silence. For many people, this is a very holy week. We're observing Ramadan, Passover, and Easter. And as we observe our holy days, I ask that we say a prayer for all those we have lost to violence this last year. So please join me in a moment of silence. And I want to express my deepest appreciation to our Board of Supervisors for championing the expansion of programs that address the root causes of violence, including lack of access to jobs, the shortage of safe housing, and services for people in crisis. With support from all of the supervisors, this board has consistently led efforts to prevent all forms of violence, and they are the fiercest advocates for community safety measures. We thank them for their steadfast commitment and leadership in addressing the issues of gun violence in LA County, and I want to shout out to all of the health deputies who are with us today. I believe we have Anthony Cepedes, health deputy representing Supervisor Hilda Solis, and Jessica Jew and Natalia Romo, the health deputy, and the justice deputy representing Supervisor Holly Mitchell. Their leadership in making sure that the resources are available and policies are created that contribute to building safe and thriving communities for all of us is in fact essential. I also want to recognize that we're joined by the Director of Military Affairs. Thank you so much for being with us today. And again, all of our amazing community partners. I acknowledge and thank our other speakers today as well for their extraordinary partnership and work. You're going to hear from David Guizar, a skilled and dedicated leader at Crime Survivors for Safety and Justice, Kevin Orange, an exceptional trauma prevention initiative community intervention worker, and Dr. Susan Stone, the Senior Medical Director at LA Care Health Plan, who has been showing us how to integrate comprehensive prevention services within the healthcare system. I also want to thank and acknowledge Andrea Welsling, the Director of the DPH Office of Violence Prevention, and her entire team for working tirelessly in partnership with community-based organizations to mobilize for peace in our communities. We all know there's a lot of work to do. We're living in an era of appalling gun violence in this country that shows no signs of abating. During the first 11 weeks of 2023, the United States experienced more than 100 mass shootings. This includes the horrific event that occurred here in Monterey Park this past January, one of the worst mass shootings in LA County's history. Just as frightening is the reality that every day in America, thousands of families, friends, and coworkers grieve for friends and loved ones that they have lost due to gun violence. Every day in America, millions of parents send their children to school with the unsettling thought that the once unthinkable could happen to their children. And every day and night in America, people gather in churches, temples, stores, clubs, and concert venues, once inviolate spaces that in the recent years have been the site of horrific mass shootings. It should be obvious to each one of us that we cannot continue this way for ourselves, our children, and our grandchildren. Without sustained, meaningful action on gun violence, we are all but conceding the future and we are noting that it will be no better than our grim present and perhaps worse. In June 2022, following mass shootings in Buffalo, New York, and Uvalde, Texas, and with an increase in firearm deaths in LA County communities, the Office of Violence Prevention joined with others to convene community and faith leaders, healthcare and mental health experts, public safety agencies, social service providers, and public health practitioners as a task force to develop a comprehensive gun violence prevention platform. The task force used a public health framework to develop a community safety plan that includes 40 strategies, including common sense gun legislation, public awareness campaigns, training programs, intervention services, healing spaces and services, and primary and preventive interventions for our young people. After considering the outsized role that racism, homophobia, misogyny, transphobia, and economic injustice play in perpetuating cycles of violence in many communities, the task force has issued a call to action, and they've identified the following 4 priorities as the critical first steps towards making LA County safe and secure for all. First, we need a ban on assault weapons, and we need deterrence to illegal guns and gun trafficking. Second, we need to improve awareness and enforcement of gun violence restraining orders. Third, we need to invest in comprehensive school safety by expanding programs and services that support our young people. And fifth, we need to address the complexity of trauma through culturally relevant healing services. The Gun Violence Prevention Platform represents one of the most extensive, multifaceted plans ever put forth by the county to address the scourge of gun violence. It rejects the idea, all too common, that we have no choice but to resign ourselves to this insidious threat to daily life and well-being. Instead, this platform is rooted in a deep understanding that violence is preventable when we understand its causes. We are acutely aware that we are living at a time of cataclysmic events and monumental challenges. A once-in-a-century pandemic, a climate crisis that imperils the very future of our planet, very real threats to our system of government, and the sobering reality that more than 400 million guns are circulating in American society. We all know that addressing even one or two of these issues cannot just seem daunting, but impossible. And yet, I have also been struck these past few years by the extraordinary determination and courage displayed by ordinary people who step up to make a difference. People who are not only willing, but committed to change the current course of history for the better. People like all of the people with me today, who are working so hard to ensure that our communities are places where all people thrive and are safe from harm. Together, I believe we can make a real difference. Thank you very much. And now I'd like to invite Arthi Harper from Public Health's Office of Violence Prevention to introduce our next speakers.
Thank you, Dr. Ferrer, for your important words today and just every day for your leadership and support to our office and on this critical public health issue. Good morning, everyone. My name is Arthi Harper, and on behalf of our Director of Office of Violence Prevention, Andrea Welsing, and our entire OVP team today, we are so thankful to all of you, our county and community partners behind us, in front of us, watching today, for all of your support, for being here to stand in solidarity with us and demonstrate a collective commitment to eliminating gun violence from our communities. I have the honor of introducing 2 community leaders and specialists in the field of violence prevention and intervention who are working on the front lines to address trauma and violence and build community healing and peace. First, we will hear from David Gizar, Membership Engagement Manager for Crime Survivors for Safety and Justice.
Good morning, everyone. My name is David Guisad, and I just want to definitely thank all of these amazing folks here with us today. And, you know, we couldn't be here without them, right, for the courage to step outside of what we have often recognized of being normal, right? I grew up in South Central LA at a very young age. I lost my brother Oscar to murder. So at a very young age, I began to really process how difficult it was to even think about safety, right? When it was directly impacting my home every day, the unaddressed trauma, the insecurity, you know, was definitely alive every single day. You know, jumping gates to access a playground, you know, wanting to be safe and things of that nature were very difficult, right? So, you know, I think that one of the things that I've learned over these last few years is that access to services is definitely critical. You know, when I didn't find the right support and solutions, I dove into a heavy drug and alcohol use. I've now been, you know, away from that for a good amount of years, and because of that, I feel that I can process a little bit more of what is in front of me. Unfortunately, in 2012, I lost another brother, Gilbert, to homicide, and that's when I began the process of really advocating for victim services. And I found that it's not as easy as it may seem, right? That is definitely very difficult to access these services when at the time the state had a surplus of victim services. We found that many people in our communities were not even aware that these services were available and were not being offered at times, and oftentimes discriminated against. So if we're going to shift the narrative and the circumstances in our community, we need to expand victim services. We need to eliminate the discrimination and the barriers of access in these services. And we need to provide real help now. You know, we need to eliminate the red tape to access in these immediate services that will often shift and can make a difference in eliminating retaliation by feeding well-being when harm has occurred. And we also need to expand the living wage for these amazing folks out here. You know, they need to make real money, you know, and so we need to definitely increase that living wage for these individuals who every day are risking their lives. We need to expand models such as community-based public safety and community violence intervention models in our communities, but because it's a profession, right? And in order for them to be sustainable, we need to make sure that the funding is there available. We have 18 trauma recovery centers in the state of California, 23 soon, and about 8 of those are here within LA County. So we need to continue to build this network of well-being. Thank you so much. And, you know, again, you know, my major respect and love for these amazing superheroes and sheroes behind me and in front of me more than anything, right? You just don't see them that way physically, but in spirit, that's where I hold them. Thank you so much for your amazing work. GUIZAR.
Thank you so much, David. We so appreciate everything that you do in community and here today. Our next speaker is going to be Kevin Orange. He is a community violence interventionist for our office's trauma prevention initiative, and for Soledad Enrichment Action, and is also the executive director of Advocates for Peace and Urban Unity.
Good morning. Good morning. I don't take this as coincidence. I think it's that we're here for a purpose, and to be here on the weekend of the resurrection of one of the person that's high in my life is Jesus the day he was resurrected. This is the weekend I'll be here speaking, talking about gun violence and talking about peace and saving lives. As you can see the shirt I'm wearing, it says, "Let me live." Then some vital words that we echo when we marching on on King Day parades, from ceasefire that we chant out, It's a cry for the young that we don't talk about. We sit here in meetings and we make decisions on our kids' lives in our community, but we never have them speak or say what they want. And so we say it for them. And the first thing we can start with is just let's say their lives. And so I would like to, let me see, I written down something. I really don't like writing down something. I like to speak from my heart, from my spirit. But this weekend is the resurrection of the Most High. So now it's time for us to resurrect the people and come together to address the traumas and anxiety of the people, to end gun violence with help and support of the community members and the county, with the help of DPH, OVP. We have resources and services now, because this started, like, for me, probably like in 2007. I grew up in the Westmont community. And so in 2007, I was at a candlelight vigil for a loved one of mine, my family members, and my twin brother was killed and my cousin was killed. And so the scream that I heard from my mother was something I never heard before. I heard her mother pass away, brothers, sisters, but the cry of losing a loved one, that pain is much deeper than any one of us could ever want to experience. And so I just demand the women that's here, I would never want you to feel that pain that most women, mothers felt of losing a loved one, because my brother might have been 45 years of age, but to my mother, he was a 1-year-old child that was freshly born. So these are things we don't listen to, but the work that we do in this community, these are cries we hear from our mothers. These are cries we hear from the people, the youth in our community who just let me live without even speaking a word. Just the pain in their eyes, and to know that we know family members that they done lost, we speak for them. And for me to leave here today is something that we can all take with us. Let me live. Let our kids live. That should speak and sound louder than anything we can talk about. And so, but I want to speak on it before I end. Even though I started this work with the county probably 6 years ago, didn't know where we was going, but we headed we in the right direction. I think we came to a good place. And so now that we done got the ears of the county and the city, they start bringing funding around here. If you want to come here to provide services, don't look at the money first. Look at the people first. Come with the services, with the heart and the love of the people to save lives. Because when you come in here with the intention of looking for the money, because you know the money is here in the county, you doing our county and our people and our youth a disservice. So I'll leave you with that, and thank you for letting me share.
Thank you, Kevin. You have been a key partner for our office from the start, before our office was even created, so thank you. Our final speaker is a critical partner in this gun violence prevention movement, the medical community, especially those providers and practitioners working in our trauma centers and our emergency rooms. This is their lane. DPH and OVP are so thankful to LA Care Health Plan for their commitment to working with us to address gun violence in Los Angeles County. Please welcome Dr. Susan Stone, Senior Medical Director for LA Care Health Plan.
I don't know if you could see me behind. I'm a little short. You get it, right? So the first thing I'm going to say is, let me live. That rings very loud. And I'm very honored to be here today and being able to speak about gun violence without losing my job. We need to have rights. So, having worked for many years in one of the bigger trauma centers, I had way too much experience with gun violence. When I went through medical school, we graduated, we put our little coats on and went out into the world. We took what was called the Hippocratic Oath to do no harm. But never in my life would I have expected how ill-prepared I was to deal with violence in the emergency department. To see the tragedy being part of trying to keep people alive after mass shootings, but more commonly wrapping 5 teenage boys up on Mother's Day from mass shootings on the street here. I think that you never get over those cases. You don't get over a 4-year-old who found a gun in the house that didn't have a gun lock and they've shot themselves. Gun violence takes seconds. There is no thinking, there is no reversing. The damage is done, and some of the weapons that are out there are just one thing in mind, and that is death. And these things impact all of the providers, surgeons, physicians, nurses, social workers, all of us. This is our lane. We have been told to stay out of this lane, but this is our lane. Gun violence is a health care emergency. So we take care of people who are in wheelchairs from a bad moment in time that they will be in for the rest of their life. Head injuries. It goes on and on and on. And I've been going at this for a very long time, and I'm sick of it, and we have to do something about it. I look at gun violence kind of like an onion. I'm not a big onion person, but when I think about gun violence, there's so many layers, right? I'm not a politician, so I'm going to leave that to the side, but I support sensible gun legislation, right? Screening. We have, I don't know if you guys recognized, we have a mental health crisis in our country. There are a lot of people that are angry, depressed, lonely, desperate. Many reasons for that, and it's gotten worse through COVID. We have to deal with that. A lot of these gun deaths and injuries surround around emotional difficulties. It could be we have an increase in suicide, right? So I don't know if you've ever known anybody that has killed themselves, but I have, and it always leaves you empty. Could we have somehow done something? Could we have seen it? And this is where healthcare providers come in, and you all come in. Gun owners, somebody has a gun in the house, are they acting different? Are they more despondent? Are they sad? Are they exceptionally angry? Is it time maybe to get dad's gun out of the house, or mom's, and maybe take a break till they can get some services? Number one, fights between people. How do we diffuse those? There's peer support groups, removing people from these toxic situations where a gun is just too quick to act without any rational behavior. It's all emotion. We have to do a better job, and the medical community is embracing this. We are starting to screen. We have a simple question to ask patients, and we're trying to get everyone to do this. It's not a crazy one. It's a simple question. Do you have a gun in the house? We ask if you smoke. We ask if you drink. Do you have a gun in the house? Yes or no? How do you store it? Does it have a gun lock? Can your children get into it? Basic questions, but even more, are you depressed? Do you need some support? We have all of these services. They are available. We need to identify in our community. This is not just a job for law enforcement. It's not just a job for doctors and healthcare workers. Our whole community must be engaged. When you see somebody who is at risk, it's time to say something to a family member or whoever's closest. Get the gun out of the house. Try to diffuse the situation. We need to all be seeing something, saying something. Healthcare providers have the ability, maybe not so much anymore, of being able to get trust from patients. And this is part of that sacred relationship of honesty and concern for someone when you know they are in a desperate way to intervene. So we have those services. We also have need for more gun safety, and this is one thing we've been talking about at our health plan, educating people on gun safety. Some people buy guns because they think it's going to be safe and they want to protect themselves. I wouldn't know what to do with a gun if I had it. And that happens to a lot of people, and there's injuries that happen. Buying a gun because you want to protect yourself is backwards logic. but it creates a lot of injuries. So we have the layers of this onion, and together we need to peel it back. We need to know that you can talk to your doctors, get them involved. We will work with you to get you services. We want our children to be safe too. Children that grow up in homes with violence are forever impacted. You just heard what our great speaker said. Trauma influences the hard wiring of your brain, we know, at a very young level. We need to make sure our children don't grow up in fear and repeat some of the same behaviors. It starts early. We can't let our kids go through this anymore. They can't be afraid. They deserve the right, like some of us had, to go out, get dirty, play in the grass, and climb a tree. They deserve that right. And gun violence takes that right away from them. So, number one, we've talked about safety in schools. That's a big objective. But we also have to be good parents, neighbors, by recognizing when somebody's at risk for a bad outcome. We have to be good doctors, nurses, social workers, and intervening with education, because you would, from trauma surgeons to ER doctors, that's what we do. It's what we have to do. And we can't always let people live, because these weapons are so awful what they do to the body. They explode organs. And I'm not trying to be crude, but it's a reality. So I hope that you take this to your heart and your brain and personalize this for all of us, because this is all of our responsibility. We can't just wait for legislation to change. I think we've seen that. And so we all have to take partnership in this. This is our call to action. Thank you so much.
Thank you so much to all of our speakers for sharing their wisdom, their stories, and motivating us to work together to make sure that our children and our families can live their lives without fear, threat, or the reality of violence harming them or their loved ones. I do want to invite all of our speakers to join me, and I want to open the floor to your questions. Yeah, thanks so much. We have been working on this for years. The people who you've heard from have been working on it for decades. I think what's different is we have a countywide platform. We've brought together individual efforts, community efforts, some that have been in some that have gotten a lot of attention and are very effective. And we've said, you know, what can we do countywide to make LA County a place where people don't live in fear from violence? But I think this work has been ongoing for so many years. Law enforcement is a big part of our work. They're on our task force. There's no way we do this without working closely with law enforcement. We benefit from their wisdom. We benefit from their knowledge. They need to be part of our solution. And we're blessed here in LA County to have both our sheriff and our police departments working closely. Sure. We've all learned, and I think you all just witnessed this, public health doesn't do anything by ourselves, ever. We're best when we work in partnership with others. So one of our roles here is to make sure that everyone understands that violence is preventable, and because it's preventable, we can look at it through a public health lens. That means that you get to prevent and put out intervention strategies. Sometimes in the past we focused a lot on a law enforcement strategy, find people who are doing things that are wrong and punish them or get them out of the way so that they don't do any more harm. But that didn't work. I mean, we've been doing that as well for a long time. I think we've learned that we have to start at the root causes. We have to understand what factors contribute to violent behavior. We have to try to build, as you've heard from everybody, skills. We're going to have to heal. Lots of people have a lot of trauma, and hurt people are much more likely to hurt people if they don't get to deal with that trauma. So the public health approach is the sort of more comprehensive approach that says we have to do it all, and we have to do it all in a way that our various initiatives are building on each other. And that's why I'm so grateful to everybody who's here. You didn't hear from all of our partners, but each organization that's here, each individual that's here, is helping us at our schools. You know, school safety, we hear a lot about school safety right now. I was a high school principal for years. I can tell you that school safety starts with children trusting the adults in the building, particularly in high school. So that those trusting relationships help everybody understand where there may be dangerous situations that are brewing so that you can intervene before something bad happens. So part of working in schools is working to create those communities where students are respected, they thrive, they have leadership roles, and we have services and supports. I know that I think both of our speakers spoke a lot about economic security, you know, working to make sure people have good jobs, not just our violence intervention teams, but everybody. Economic instability does not help people deal with trauma. It doesn't help people have a stable place to call home and to build the relationships that we know sustain us all. But I appreciate that question. I don't know if you guys want to. You know, there's a place for mourning. There's definitely a place for prayers. There's a place for us to come together as a community and give grace and thanks. But right now, the most important place for us to be together is a place to take action. You know, we are not hopeless at all. And we have to change the services, the supports, and the policies that allow this kind of violence to thrive in our communities. None of us are benefiting from the status quo. Do you guys want to add?
I'll add to it. What I done witnessed over the years, just growing up in Westmont, is the unresolved trauma that we didn't know we was dealing with. And not only just us as the community members, it's the people that work in there. It was the teachers, it was law enforcement. Everybody didn't know how to deal with the traumas that they was facing. So we lashed out on each other. But growing up and understanding what it is, because I'm also a victim of gunfire. I was shot 8 times. And so I understand, you know, what a person go through mentally. I know the doctor told me I would heal fine, but he was worried about me mentally. I didn't understand. I'm walking out, I'm good, until I suffered a panic attack. And I dealt with anxiety to make me understand for people that I work with now that when you go through something traumatic, your body and mind goes through a whole lot of stuff where you think you're going crazy, where you want to do something to yourself or somebody else. But when you get around people to start healing yourself, to talk about trauma and how it affects you, that you're not going crazy, we give you tools to get yourself through these things. So that was made me a better person to come back in my community, to service someone that suffered a traumatic experience, to share my experience and show them there is hope after getting shot, you know, but we all got to work together. We shouldn't work in places where we point the finger, blaming law enforcement, or blame community. Well, we all in this together, and we got to heal in this together and help support each other so we can live. Thank you.
Amen.
Yeah, I think that, you know, one of the things that we find is that I think it was like in 1985, there was a mass shooting at 49th Street Elementary School. That's in South Central, right by Carver Elementary. You know, I'm old enough to know that it happened, and I researched it, and I confirmed that it happened. And it was elementary school kids. At that same school, there was a young man, you know, he was about 5 years old, that was really worried about his grades and got dropped off at school and then shot himself, you know, in front of the school, right? And I don't recall the type of services that we see in different types of communities, right? So when I talk about, you know, the the discrimination, we see it at different levels, the way we respond and humanize who the victim is, right? So, if you don't know 49th Street Elementary School, it's like in South Central LA. Most of those kids that were harmed were very likely Latino and Black. And so I think that we need to continue to elevate and humanize the elements around the violence, right? And we're talking about it from gun violence, but there's so many different levels of harm that do occur. And I'm grateful for this opportunity to be here because, it gives us this, to continue to cultivate these types of relationships that unaddressed trauma does have an impact, right? I just drove through the neighborhood where my brother was shot, my brother Gilbert, at a wedding, and I saw some of the guys that hang out with the guy that shot my brother. He's been arrested, convicted, but it didn't stop me from that adrenaline pumping and having those thoughts. But then I have something to lean on. I have, sobriety. I have, wellness. I have, a different purpose that I committed myself to, and it helped me get through those key moments, right? So we continue to cultivate wellness and well-being when harm occurs, we will begin to reverse and, actually not begin, but continue to reverse the elements of intergenerational violence. That's how we used to call it back in the days, with intergenerational healing. So let's build on intergenerational healing.
Thank you so much. If there are no other questions, we're grateful for the media for showing up to cover this. We're in debt to all of our community partners, and we will, in fact, move forward with this action plan. You all have a copy of it, and begin implementation in all 4 areas so that we can comprehensively address both the root causes of violence, but also stop the killing.